Today we're going to demonstrate our technique using all knotless fiber tacks for a 360-degree labral repair. This is an excellent choice in these situations as you want to reduce the overall bulk of anchors, and these are much smaller footprint. This patient had a 360-degree labral tear with continued pain and slight instability both posteriorly and anteriorly, and failed non-operative management. You can see here we're working posteriorly now using an elevator. We've already elevated anteriorly in preparation for fixation. In this situation, we will fix the entire labrum posterior and anteriorly. We want to reduce the amount of capsular closure we're doing to reduce stiffness, as these patients can get quite stiff if not done appropriately. Again, this is a less common situation and only represents about 3% of all labral tears. We use a shaver and in addition use it for some bone cutting ability to clean both directions to fully prepare the labrum for fixation. Here we're facing posteriorly, initially we were anteriorly, and we're in the lateral position, viewing from an anterior superior portal. We place our first knotless fiber tack. The nice thing about these posteriorly is they have a 15-degree angle and they have a very small footprint, especially if you're doing a 360-degree repair or anterior and posterior combined. We've engaged the anchor. Following this, we will pass it with a Limbitech suture passer. In this situation, we do not need to grab as much capsule, so we just do a labral repair. Use our PDS suture. Again, with these knotless anchors, it's important to do this pull-through stitch so there's no catching or locking of the stitch. And then we engage it, and we're able to self-tension the amount we want without it pulling out. In some cases, there's some friction in the system and a knot pusher is needed. This prevents any chondral damage with final tightening. You can see here we have excellent tension of the inferior posterior portion. We pick a second anchor, again using the 15-degree angle. We can even use a 30 if we're worried about penetrating the glenoid. We again pass this Limbitech passer, and we pass the blue stay stitch through the labrum and engage it again for a second knotless anchor. You can see here we recreated the bumper appropriately without over-tensioning the capsule. Following this, place a third anchor at the more superior posterior portion. Again, engaging the anchor. Here we pass with the crescent through a small part of the capsule and majority of the labrum. We pass the blue suture through the labrum. Again, we're making sure to grab the loop suture as well as the blue suture together and make sure there's no tangles, and then we engage the knotless fiber tack. This is the most effective method to do this to prevent any tangling, as there is a small learning curve in these anchors. You can see with excellent fixation posteriorly. We turn our attention now anteriorly to the anterior portion. I usually make a trans-subscap portal, but in this situation with these type of fiber tacks, given the 15-degree angle, it is not necessary. We place our low anterior inferior portal. Following this, we use our Limbitech passer to grab appropriate amount of capsule and inferior glenohumeral ligament. Pass our PDS suture and our blue suture through this capsular labral portion. And then again, we make sure there's no tangles in this knotless system. If you do this appropriately and take a few extra seconds to check it, you have a very successful outcome without any tangling of the knotless function, which can be extremely successful in the situation that you can tension appropriately more or less as needed. We engage the knotless function. We cinch down the labrum. You can see here we have an excellent further restraint of the anterior inferior anchor and inferior glenohumeral ligament. Now we place our second anchor, again engaging this. Following this, passing this through the labrum with our Limbitech passer. Again, in this situation, we're doing interrupted sutures, given this is a 360-degree labral tear, to prevent over-tightening. In most cases, I'll do a horizontal mattress for at least one or two of the anterior and inferior anchors. We are checking to make sure that the knotless function and the sliding function of the sutures is still available and does not get caught. And then again, doing the similar method to make sure there's no tangles. Now we are engaging this knotless anchor in, and we have an excellent capsular labral repair. Following this, we put a third anchor. Again, knotless. You can see here we've got small footprints on all of these, and none of these coalesce with the anchors posteriorly. This is only a 1.7 millimeter footprint. Again, Limitech passer is used. Care is taken not to damage the sutures in this knotless anchor. Following this, passing the blue repair stitch through there, and again checking for any tangles. In this situation, you take the non-fiber tape white suture and the blue suture, and then you engage this. In this situation, there was slightly more capsule taken, and so you're able to use a probe to reduce this. Nice thing about the knotless function is you can adjust things before final tightening. And here we've adjusted this for the appropriate amount of repair. We'll use a knot pusher if needed to get further tension, and then finally cut it flush. You can see here we have an excellent 360-degree labral repair, and we're happy with this. Following, we probe it, and there's no further movement. This is a good technique if you want to have a low profile option when you have to put a number of anchors into the glenoid. In addition, it prevents any issues with knots and crowding of the anchors themselves.